Okay, well, hello everyone. Welcome and thanks very much for joining us for today's webinar. I'll just make a few introductory comments before we start. So I'm Neil Ward, I'm based at the University of East Anglia in Norwich and one of the co-conveners of the AFN Network Plus. The network is focused on the UK agri-food system and identifying and tackling the barriers to transitioning to a net zero UK by 2050. And it's funded by UKRI, the umbrella body for the British Research Councils, for 3 years, and we launched last autumn. We're hosting a range of activities to promote interactions and knowledge exchange, and we'll be commissioning research projects shortly in 2023 and again in 2024. You can apply to participate in our next event, which is in Bristol on the 21st and 22nd of June, where we're going to be discussing research project ideas. And you can also sign up to become a member of the network if you're not already via our website, and we'll put a link in the chat so that you can sign up if you wish and find out more details about the Bristol meeting. Today is our fourth webinar of our series, and we're very pleased to have Professor Charlotte Hardman with us. Charlotte is Professor of Psychology of Eating Behaviour at the Institute for Population Health at the University of Liverpool. And she studies the psychological aspects of food choices around health and sustainable diets. And understanding consumer behaviour and food choices is an important part of the debate about a more sustainable agri-food system as we consider the net zero transition. But Charlotte also works on questions of poverty and inequality, which have an important bearing on how we think about food consumption. So Charlotte's going to talk for about 25 minutes or so, and there'll be plenty of time for questions and discussion afterwards. Please feel free to put questions in the chat, and we will try and gather them and get through as many as we can. But we will be finishing at 1 o'clock sharp, so we won't overrun. We're recording this session, and we'll be aiming to put it on our YouTube channel for others to see. You can get to our webinars on the YouTube channel through the website. So if you don't want to be identified as participating, probably best not to ask a question. So I'm going to hand over to Charlotte now, and welcome, Charlotte. Thanks very much for joining us today.
Thanks very much, Neil. Really great to be here today to talk to yourselves. So I will share my screen and then we can get started. And apologies about any background noise. In classic timing, our gardeners have just started strimming outside my office. So I hope that doesn't affect the sound quality. Great. So hopefully you can see that and we're in the right mode. Could you just give me a thumbs up, Jez, if everything is okay? Brilliant. Thank you for confirming. So yeah, really pleased to be here today to talk to you. So I will start my talk with some context setting on why we need to make dietary changes to help achieve our net zero ambitions. And I will outline the nature of some of the inequalities that we see in diet and health outcomes. I'll then talk about how poverty curtails our dietary choices, and also how understanding of psychology can help change diets in the context of the broader food system. Because as Neil said, I'm a psychologist, so my primary interest is around understanding these psychological determinants of people's food-related behaviours and how that interacts with broader environmental drivers. So, as I'm sure most of you on this call know, there's an urgent need to reduce environmental impacts and global greenhouse gas emission. And we know that our current food system puts a substantial impact on our natural environment. And it does this in many ways. Just some examples on this slide here. Food production accounts for over a quarter of global greenhouse gas emissions. Half of the world's habitable land is being used for agriculture. 70% of global freshwater withdrawals are being used for agriculture, and 78% of global ocean and freshwater eutrophication is caused by agriculture. So these are just a few examples focused on production. There are, of course, other major issues with how our food is being processed, transported, consumed, and then what happens at the end, which is often a lot of food waste. And all of this has a really substantial impact on our natural environment. And indeed, as things stand, by 2050, emissions from the food system will be 4 times higher than the level that is needed if the UK is to meet its net zero ambitions. So it's very clear that we need major changes in our food system. And one way that we can do that is to change diets. And this has been widely documented. So this is from the National Food Strategy Independent Review, which was published in 2021. And this sets out the changes that are needed to the national diet in the UK by 2032 that would enable us to meet our health, climate and nature ambitions. Because of course, it's also very well recognised that our current diets, as well as being very bad for the planet, are also bad for our health and significantly contributing to the incidence of non-communicable diseases. So it's estimated that as a nation, we need to be increasing our fruit and vegetable intake by 30%, our intake of fibre by 50%. And then what we really need to be reducing are foods that are high in fat, sugar and salt, particularly bad for our health, and then also our consumption of meat, because largely due to that very clear environmental impact of production of meat. And a number of diets have been put forward that can help us as a population to transition to diets that are more sustainable and also more healthy. So, for example, the Eat Lancet diet and the Live Well diet, which is WWF's diet plan, and they have a new report which has come out just this week on eating for net zero. And what these diets generally all have in common is the emphasis on increasing consumption of plant-based foods. So that will be things like fresh fruit and vegetables, pulses and whole grains, eating fewer animal sources, and also reducing our consumption of high fat, sugar and salt foods. So as a psychologist, I'm really interested in how we can start to instigate the behaviour changes that we need to help us to meet these quite ambitious targets. And we know that one of the things that really influences people when they're making choices is their beliefs, their attitudes, their preferences. So I'm always really interested in data on this slide here, which sets out some of the factors which influence consumer product choice in this sample of respondents from the IGD. And what you can see here is that actually the impact of a particular food product on the environment is generally ranked quite low down on the list of people's priorities when they're making choices. And in fact, what does seem to be more important to people when they're making choices are things like price, the quality of the product and the ingredients, but also how healthy or how unhealthy something is also featuring quite highly. And then that's quite interesting because many of these diets that are proposed will often align healthy foods with more sustainable foods. So obviously something like increasing fruit and vegetable consumption, as well as being good for our health, is also good for the environment. So there can be these sort of win-win strategies or dietary changes that we can try to encourage, which can be beneficial for health of the public and also health of the planet. But what this does suggest is that at the moment, people probably aren't spontaneously going to start switching their choices to focus on environmental impact. So they are going to need some help in order to do that. And this is where psychology can really help to change diets in the context of the broader system. Because as psychologists, we study the individual level psychological factors which determine and influence food preferences. And then we can use this knowledge of psychological determinants to start to identify targets and mechanisms of behaviour change, which can be harnessed in intervention contexts and public health campaigns. So in the next 2 slides, I'm just going to give an example from some work that I've previously been involved in, and it relates to this issue of fruit and vegetable intake, because as we've established, we really need to be increasing our consumption of fruit and vegetables, both for health and sustainability reasons. but it's actually really difficult, particularly with children, to get children to consume these foods. And many parents, this is something that they experience. You might find, for example, that a child is quite willing and accept to try new foods early in life, but then when it gets to about the age of 18 months or 2 years old, then suddenly that child might completely change and start to reject all of these previously accepted foods. And that's really, really common. So I guess, how can we change this and start to get children from a very young age to increase and consume fruit and vegetables? So we know from the psychological literature that there are 3 components which have been reliably shown to increase children's acceptance of previously disliked or unfamiliar fruit and vegetables. So these are as follows. So repeated tasting. It's been shown in many studies and systematic reviews and meta-analyses that if we repeatedly encourage children to taste fruit and vegetables, they will eventually learn to like and accept and consume those foods. But what's really important here is this is probably not going to happen straight away. Some children may need to try a particular food 15 or 20 times before they start to develop acceptance. And that can be a real barrier to using this strategy. Some kids just really need more encouragement to start to taste foods. So this is where role models can be really useful. If children are exposed to positive peers, in particular, who might be consuming fruit and vegetables, then this can provide a very, quite a powerful role model for them to do the same. And then some kids might even need even more encouragement. And this is where we can start to use things like non-food rewards, things like stickers, to start to initiate that process of tasting. And once the kids start tasting, this is when that process of repeated tasting can start to take effect. So early in my research career, I was really privileged to work on an intervention called Food Dudes, which was developed using these 3 principles and using all of the evidence that these 3 principles are a really effective way of getting children to start to consume previously disliked or unfamiliar fruits and vegetables. And you can see on the slide there the Food Dude characters. So these were role model characters, cartoon characters who were specially designed to model the target behaviour and show children the benefits of eating fruit and vegetables. And I'll just show you some data. I mean, there's lots of research published on this intervention. It's quite an old intervention. So this is a paper from 2004, when we implemented the Food Dudes intervention in a primary school in Lambeth in South London. And the children were offered fruit and vegetables in the dining hall. And we measured their consumption using observational measures. And we took measurements at baseline and then also during the intervention and at 4 months follow-up. What that slide shows is that there is a clear increase in both fruit and vegetable consumption during the intervention, which was maintained at follow-up. And then we also had a control school who were matched on all characteristics apart from having the intervention, but they had the same fruit and vegetables available. And you can see consumption there remained low during that period. So this is just one example. This intervention has been influential. I actually think it was really ahead of its time to be doing this 20 years ago. But of course, we need to move beyond simply focusing on changing behaviour and really looking at the wider system and the other contextual and systemic factors which might be driving and constraining choices. And unfortunately, we find ourselves in a situation where a significant proportion of households in our country are experiencing food insecurity. So food insecurity refers to having a lack of stable and reliable access to foods which are needed for a healthy and nutritious diet. Food insecurity is a major problem, not just in the UK, but in many other countries worldwide. So people experiencing food insecurity will be struggling to afford food. They might be skipping meals and be having to access food aid support like food banks. And we're really seeing enormous increases in the number of food banks throughout the country. Food banks were never meant to be a long-term solution. They were always meant to be an emergency response to food aid. This issue of food insecurity has been exacerbated by many recent events and shocks. So, of course, during the COVID-19 pandemic, food insecurity levels increased. And then again, we've been further hit by the cost of living crisis, whereby many households are really experiencing this income squeeze. Energy prices have rocketed, so this means there is less money to buy food. There is also concern about using energy, cooking, using appliances like fridges, which are essential for food preparation. And then food prices themselves have increased due to many shocks and issues, the war in Ukraine, Brexit, weather, all that sort of thing. So we really have had this huge number of events sort of colliding, which has led to this economic crisis and forced many more families into this state of food insecurity. And these are just some data which were recently presented by the Food Foundation and City University London in a report published in March. And this just is some tracking that they've done of household food insecurity with households with children. So what you can see is that this really peaked in September 2022 at the real sort of height of the cost of living crisis. And you can see there that levels of food insecurity are actually higher than they were during the first 2 weeks of lockdown. So we know that there are inequalities in people's access to diets relative to income, and we've known this way before the cost of living crisis and the pandemic. So these data just show over a 15-year period in the UK that fruit and vegetable purchases are lowest in the bottom deciles of income. So just evidence for persistent inequalities. And again, the real concern here is that these inequalities have been further exacerbated by the cost of living crisis. So these data, again, from the Food Foundation and City University report, so self-report data showing the percentage of households reporting buying less of fruit, vegetable and fish. And we can see that this proportion is significantly greater for households reporting food insecurity versus households who are food insecure. And food insecurity is a massive concern because of the implications that it has for health and well-being and development, all these sorts of things. We know that having overweight and obesity is more likely in most deprived groups relative to least deprived groups, as shown on the slide here. And we also know that food insecurity in of itself significantly increases the risk of having obesity in high income countries. And the reason for this is complex, and I'll delve into that in a little bit more in my talk. It's often thought of as a paradox, but actually when we're talking about food insecurity in this context, we're not talking about access to food per se, we're talking about access to food that is good for nutrition and health. And as I'll explain in the next couple of slides, that is what is really important here. So the key issue really is around the affordability of healthy and sustainable diets. So the Food Foundation have shown us, on average, healthier foods are 3 times more expensive calorie for calorie than less healthy foods. And the figure on the right is from the National Food Strategy. And what that shows is that any of the foods to the right-hand side of the dotted line are classified as high fat, sugar, salt. And you can see that the vast majority of those foods are cheaper per calorie compared to the fruits and many of the fruits and vegetables on the left-hand side, with some exceptions. So it might be a little bit small for you to see there, but lentils and beans actually are quite cheap per calorie. And I will be talking a little bit more about beans in just a moment. But just to say that affordability is also a really big issue for sustainable diets. So data from the Food Standards Agency show that cost is the most commonly reported barrier to consuming a more sustainable diet. The other major issue we have is access to foods alongside affordability. In many lower income, more deprived communities, these can be classed as food deserts. Now, a food desert refers to a local area where there is very poor access to healthy, nutritious foods. So it might be that there's no large supermarkets in walking distance, and residents are having to rely perhaps on small local shops which don't stock a wide range of fresh produce, and there might be a lot of processed ready meals, that sort of thing. And we know that this is a really big issue. So this was the table you can see there is from a report that Kellogg's published a couple of years ago, showing the top 10 most deprived food deserts in England. So the majority of those are in the north or the Midlands, and in fact 5 of the most deprived food deserts on that list are in the Liverpool city region. There's a lot of academic evidence which is showing that in more deprived areas, we're more likely to have so-called environmental bads. So things like lots of outlets selling fast food, tobacco, alcohol and gambling. So this real sort of clustering of these sorts of outlets in more deprived areas in Glasgow in this particular example. So food access, really big issue. Just some other things I want to highlight as well. I don't have time to go into all of these in detail. High energy prices I've mentioned. So time pressures, often people on lower incomes are time poor. They do not have time to go and shop in different places and spend lots of time preparing meals from scratch. Often there will be poor quality accommodation. There might be low quality kitchen space, not sufficient facilities for preparing, cooking and storing food. And then mental health is really, really important. And I'm going to talk a bit more about that in my next couple of slides. So there's a real emotional and mental health impact of experiencing food and financial insecurity. And we know that this is associated with higher levels of stress and with higher levels of mental health problems. So stress is really important here. Stress has lots of biological, psychological and cognitive effects on us. And living in food insecurity and financial insecurity is inherently stressful, and it takes its toll on our physical and mental health. When we're stressed, it's much harder to engage in any new behaviours, and it's actually much harder to control our behaviour and to resist temptations. And it might lead people to engage in unhealthy behaviours as a way of coping. And that's what's really important to understand, is that eating is not just about fulfilling a nutritional need. We're really influenced by how we feel. Emotions such as feeling stressed, sad or anxious can lead to eating to cope. And this has implications for our health and for obesity. So we wanted to delve into this a little bit more in some of our research and to understand this complex interplay between socioeconomic disadvantage and psychological distress, and how these factors might interact to predict eating behaviour and obesity risk. So in this study, we found support for a theoretical model in our data whereby lower socioeconomic status is associated with higher psychological distress, as you would expect. But what's really interesting here is we see a link between psychological distress and the tendency to emotionally eat. So this is where people overeat as a way of coping, and this in turn was associated with having a higher body mass index. So crucially, we didn't see a direct relationship between lower socioeconomic status and higher body mass index, but we saw an indirect pathway via distress and emotional eating. And then we saw a very similar relationship when we looked specifically at household food insecurity in a subsequent study. So higher household food insecurity being associated with higher distress, greater eating to cope, and in turn, higher body mass index. So we wanted to delve more into these findings and to get more in-depth understanding of the lived experience of food insecurity. And so to do this, in this study, we conducted qualitative in-depth interviews with 24 adults who were recruited from a food bank and a housing support charity in Liverpool. So these were participants who were experiencing very acute food insecurity. And as part of these interviews, we simply asked them a range of questions. Sorry, I have a fire alarm going off. I think it's just a test. I hope it's just a test.
Oh no.
It should be. They test it on a Friday. It will go off.
We can't hear it that badly.
Oh, you can't hear it. Okay, fine.
If you're happy to go on, but don't put yourself in danger or anything.
I'm fine if it's fine for you. So we wanted to understand, it's stopped now, what factors influence food choice and eating behaviour in people experiencing food insecurity. So, I mean, I won't talk in depth about this. I have a whole presentation on this study, but what really came out very clearly here was income, the cost of food and accessibility to shops. People talked a lot about the strategies that they are engaging with to help them to conserve food, so skipping meals, smaller portions, cooking in bulk and freezing, and prioritising children in the household. There were some very interesting findings around health. Many people had pre-existing physical or mental health conditions which limited their ability to go food shopping and prepare and cook food. But what was really interesting was what participants sort of very clearly described was this sort of cycle of worsened health outcomes, where low income, lack of access to food, poor diet and eating patterns actually seem to worsen physical and mental health. So people described this sort of vicious circle, which was incredibly distressing and stressful and hard to break. So what all of this suggests, taken together, is that food choices in lower income groups are strongly constrained by structural issues. So things like affordability, accessibility of food. And this is a major barrier to consuming healthy and sustainable diets and achieving net zero in agri-food. So I guess the question is, well, what can we do about this? So I've only got a few minutes left in my talk, so I'm not going to be able to crack that just now. But firstly, what I want to highlight is that I know there's really excellent work that is going on in local communities across the country to support people on lower incomes, firstly to access healthy and sustainable foods, and also to help link up growers who are producing foods in sustainable ways with those deprived communities who need access the most. And so Sustain's Bridging the Gap programme is a really good example. What I'm going to do now for my last 2 minutes is I just want to tell you about a couple of projects, current research projects that I work on, both funded by UKRI's Transforming UK Food Systems. So the first project is bean meals. So I said I was going to talk about beans earlier on. So obviously a really great staple, very protein rich. Beans generally that we consume will generally be imported from North America. So as bean meals, we're really lucky to be working with Eric Hulob from the University of Warwick, who's pioneered a way of growing 2 new strains of beans. Godiva, which is a blonde kidney bean, and Capula, which is a navy bean. So Eric has actually been able to grow these beans in the UK at their farm at the University of Warwick. And we're now getting those beans into school canteens. So we have 6 schools in Leicestershire, primary schools, who have got these new beans on the menu. And there are some really delicious bean chilies, bean curries, bean pizza, bean lasagnas on the menu. And these staff and pupils have really got behind this. So the reason there are bi-directional arrows on that slide is because in this project, we're taking a fork to farm model for systemic innovation of dietary change. So we're actually starting with the bean meal, and then we're working backwards through the missing middle. So that'd be things like retailers, wholesalers, producers, and then right back to the primary producers to try to understand the logistics of changing the system based on beans, who are the key actors in the system and what do we need to change to make this happen on a larger scale. So that's bean meals. And then the other project, which is really relevant here, is biofood, so food insecurity in people living with obesity. So this is all about generating actionable evidence on retail strategies to address these dietary inequalities, specifically for people who live with obesity and food insecurity, because as I mentioned earlier, this is a really key population where we need to understand the lived experience, and we need to use this knowledge to develop strategies that can help people to make those healthy and sustainable choices. And so to do this, as well as academics, we're working with a number of partners, including Sainsbury's as our retail partner, and we're also working with More Life Weight Management Services. In this particular project, I lead work package 1. So this is all focused on co-design and lived experience. And we're going to be using that knowledge to feed through to our intervention work package. We've got some really exciting data, which we're just analysing now, and we will be sharing in the next couple of months. So I'm mindful of time. I'm going to finish off there with my summary. So knowledge of the psychology of food, knowledge of the psychology of food preferences provides novel targets for interventions to increase healthy, sustainable diets. I've only given a flavour, just a couple of examples, but hopefully now you can see a bit more about how psychology can be useful in the context of the broader food system. So food choices in lower income groups are strongly constrained by structural issues like the affordability and accessibility of foods. And this is a major barrier to achieving net zero in agri-food. it's really important to understand broader contextual issues like mental health, and to understand the complex interplay between food and financial insecurity, mental health, and the psychology of eating. And it's really important that we work in partnerships to do this. So academics, working with schools, with retailers, with the public and private sectors, and with policymakers to change the behaviours of multiple actors in the system. So finally, just some implications and what I think would be take-home messages for policy and practice. So systems approach is absolutely essential. We cannot just focus on individual level behaviour change if we are not making upstream changes that are going to support and facilitate that behaviour change. It's essential that we incorporate the lived experience and co-design, working particularly with populations which are hardly reached. We need to use evidence-based strategies rather than just what we think would or should work. And it's also really critical to avoid language of blame and personal responsibility, whether we're talking about what somebody eats or their weight. It's really important that we emphasize the wider systemic factors which contribute to this. So that's all for me. I'll stop there and stop sharing, and happy to discuss and take questions.
Thanks very much, Charlotte. That was great. You ran through that very swiftly and clearly, and lots of questions have been emerging in the chat as you've been talking. So I'm going to just try and sort of pull them out, and we'll try and get through as many as we can. There's a sort of a bit of a discussion about whether it's better to target change in the food system itself or the environment that people are in when they make food choices, or sort of aim at the individual decision maker. And perhaps could you say a little bit more about, because I'm sure there's a sort of bit of everything in there, but how do we think through those dilemmas about the sort of structure, the environment for the decisions and the individual decisions themselves?
Yeah, so I think it's that understanding of the system and that systems thinking, which is so important. So in order to change a system, we really, first of all, need to understand and map that system. Who are the actors who we might need to change? What unintended consequences could there be? So it's almost like that sort of baselining in a way, I would say, where it's sort of like, well, this is the current state of play. Where do we want them? Where do we want to be? And how do we get there? And what are all the pieces in the puzzle that we need to change? And if we change this, what's going to be the effect on that? So it's really quite a complex process. And we are seeing systems thinking being used a lot more. In terms of, where we actually target, I mean, I would target that where we actually make the changes. Again, that's going to depend on different scenarios. But in the food system, I mean, I would argue we need multiple changes, but all working to that same agenda. But as I said in the talk, if we just focus on individual behaviour and we're not changing policy or environment, then behaviour changes will likely fail. People don't want to engage in behaviours that are effortful or difficult. So, you see a lot written about, well, we've just got, and it sounds really simple, doesn't it? But, we've just got to make these behaviours that we want people to engage in. We've got to make them easily available, effortless. And so ultimately that they become the norm. If we want to get people to cycle more, then we need more cycle infrastructure. We need more cycle lanes, but we still need people themselves to want to cycle. So I would say it's both.
Okay, thank you. It was really interesting the way that you set out the mental health issue and the way that it can drive dietary decisions and practices. I think it's Francesca in the chat made a point that that poor diet can influence mental health as well. So there's a sort of there's a dynamic there. There's a mutually reinforcing sort of problem, and I wondered whether you might be able to say a little bit more about that.
Yeah, absolutely. So it's such an important topic, and I think it's something that's not immediately obvious to everyone, but there is a lot of evidence certainly about obesity and mental health problems co-occurring and developing together. So I published a paper a few years ago, it's in JAMA Psychiatry, where we looked at the Millennium Cohort Study, which is a large cohort of individuals who've been followed up over several years. And we showed that this co-occurrence between obesity and emotional problems starts from about the age of 7 years. Prior to that, there isn't a lot of evidence of co-association. So there's clearly something going on in middle childhood where we're starting to see someone's weight and their risk of mental health, emotional problems starting to co-occur. And there's so many reasons and mechanisms why that might be. There are biological mechanisms, but as a psychologist, I'm principally interested in psychological mechanisms, so things around using food as a way of coping. I can see somebody's mentioned weight stigma in the chat, and that's just such a huge issue for people who live with obesity and so detrimental to mental health. And as I said in the talk, in the context of food and financial security, the impact of mental health is enormous. Many people might be bringing pre-existing mental health problems that they may have had for many years, but actually the experience that they find themselves in in most cases makes that mental health problem significantly worse. And there's sort of this vicious cycle, which is incredibly difficult to break. And that's why we have to be so careful with some of the language which is used around blame and personal responsibility, and really try to develop an understanding of other people's situations and what other people are sort of bringing to the table. We're not all on a level playing field.
Some people have mentioned growing food and growing vegetables, and the influence that can have on children's thinking about food and their appetite for healthy food. Is there anything you might be able to amplify on that?
So I'm very pleased to see people talking about growing fruit and vegetables. That's another one of my real passions, and not as a grower, I should add, but in terms of research, and just didn't have time to cover it today. But absolutely, I see growing your own fruit and vegetables as a really excellent solution to many of these problems. There are loads of benefits, obviously, in terms of access to healthy foods, of course, if you are a good grower, but in terms of healthy and developing more sustainable eating practices. So we've got some research led by Beth Mead, which shows that people who grow their own food are more likely to consume healthier diets, and that is explained by them being more likely to make healthy and sustainable food choices. So there are definitely links there. Really great examples of community food growing happening in the community, allotment food growing, and particularly, there's a lot of food that successful growers are able to produce. Really good examples of some of that produce actually going back into the food system and into the food aid sector so that it can get to those who need it most. And I think that's really important, because not everybody is going to be able to have access to food growing spaces. Not everyone will have the time, the inclination, or the skills to do it, because it is time consuming. But there are community food projects, community gardens. I run a network in Liverpool called the Liverpool Food Growers Network, which is 50 community food growing organisations from across our city region. There are many well-being effects as well for people who are involved in community food growing, and environmental impacts are starting to emerge. So I think it's a really great initiative that we can be pushing, not for everybody, but certainly part of the piece, in one piece in the puzzle, would be my opinion.
There's a question from Sonia, which was, clearly there's an issue with the households that are in poverty, but then there are the households that aren't in poverty, the rest of the population. And is there anything that can be done to incentivize sustainable diets amongst those for whom it's sort of straightforwardly affordable?
No, I mean, it's a really interesting question. I mean, I think if you can afford food, then that's good. That's certainly puts you in better stead. I mean, there are products out there. There's a whole host of sort of more sustainable and healthy food options available in many different ways. So it might be there's a value there for sort of greater education and just sort of spreading the word, I guess. So I guess, you know, if you're already, if affordability isn't an issue and accessibility isn't an issue, it could be then to do with things like general acceptability, because it might still be that, well, people still don't want to eat those foods, even though they can afford them, and, you know, we have to accept that. So I guess then it's trying to understand, well, what would be a good substitute. So, you know, just to give another example, if people really like drinking full fat Coke, but we know sugar sweetened beverages are a real no-no in terms of health and weight and all that sort of thing. So it's looking at substitutions we can make. So in that sort of scenario, switching to a plant-based or a lower calorie sweetened version of that beverage can be a sort of swap. So I think there are strategies that we can look at. If we can look at, well, what are people's current preferences and how can that preference be accommodated, but with health and sustainability at mind, and food reformulation can be one way to achieve that.
Great, thank you. There's all sorts of people are putting little links to their local projects or local initiatives or research. So there's lots going on in the chat, which anyone who's interested in finding out more might look through some of those links. But I've just seen a question from India. That's India Langley, who's a member of the network, one of our champions. Have you noticed much underlying stigma or blame in the narratives around alternative food networks?
Oh, that's very interesting. You know, I haven't, but I'd be really interested to hear from people who have, but I haven't personally.
She says, I'm often disheartened to see messaging about voting with your wallet and prioritising quality food over luxuries when people are advocating for alternative food networks.
I can find that one.
It's at 12:43.
Oh, yeah, I've got it, yeah. Yeah, I'm not entirely sure. I mean, India, feel free to follow up. Sorry, I'm not quite sure. It's not something that I'm not sure I entirely understand your point, but feel free to follow up. Happy to have a go at answering.
There were some questions earlier on as well about you know, the stage when children become independent consumers themselves and they got their dinner money or their pocket money or whatever, and they're just then immersed in a world of you know, supermarkets with unhealthy food really heavily promoted. And so anything particular that interventions around that age group or thinking about what can be done that age group where children become you know, consumers in the marketplace themselves?
Absolutely. So as a parent of a teenager who did all the things I was supposed to have done, and then they go out into the real world. I live in an urban area where a typical urban food environment of your big high street chains, a real culture after school of going to those high street chains and spending money on lots of high calorie food and drink. So I think we need an absolute massive culture shift within our food environment. I think teenagers are often forgotten about because they're quite difficult to engage with. And I think rightfully so, a lot of research focuses on the early years, which is really, really important. Beam meals, we're obviously working with primary schools. And the idea is, well, if you can instill these healthy food preferences, they should persist. And that may be true to a certain extent, but we know that young people are particularly influenced by the behaviour of others around them. So if there is a culture of going to a takeaway or some other fast food restaurant after school, then it's very likely others will follow suit. So again, this is talking about these changes in the food environment and these broader systemic changes. There's been lots of policy around trying to limit takeaways around schools. So that is an area which is ongoing, but it's very complex and there's lots of loopholes, and fast food restaurants often don't count as takeaways. So really, really complex and tricky to navigate. But my argument would be that we really need fundamental shifts in sort of the way that food is embedded into our culture. And again, it's often thinking about these sort of swaps. So, you know, we know that young people really like going to McDonald's. Well, I guess how can we sort of recreate that similar sort of food with health and sustainability at the heart of it?
Okay, thank you. I'm going back to India's point about stigma and sort of alternative food networks. I don't know whether we might have been able to get India to be able to come on mic. I can see her there. India, do you want to sort of develop your point?
Yes, absolutely, I can do that. So I think my point is I often go to sort of panel discussions and events and things like that where people are talking about sort of fixing our broken food system. And a lot of the time the suggestion is that regular consumers need to be paying more for their food and that it's a matter of priority to do so. So I went to one recently and they had a really beautifully put together host. She looked amazing, and what she did was she proclaimed that the reason that she could afford to buy organic, sustainably produced food was because she didn't buy new clothes. Right. And that it was a matter of priority and that other people should be prioritizing. And I found it quite uncomfortable because I felt like that isn't actually the priority that people are making. There's often sort of said that I was like, well, if you didn't buy new iPhones, then you could afford vegetables.
Yeah.
And I often find this rhetoric really frustrating, particularly when it's coming from a you should be doing better so that we can all live on this planet kind of perspective.
Yeah. Oh, I absolutely agree, India. So thanks for explaining that. And I think, it's this sort of it's this blame narrative, isn't it? And oh, well, if people are affording that, then why can't they afford this? And, at the end of the day, we're all entitled to nice things and luxuries. That is sort of a basic human right. Everyone should be, have access to nice things, but everyone should also have access to healthy, sufficient foods. So, I absolutely agree. I don't think the sort of blame culture is helpful. I don't think that you should do this is helpful. And I think we have to be mindful of other people's perspectives. I find the co-design work and the lived experience work I do just so informative. I've learned so much from going out and talking to people who I wouldn't in my day-to-day life or my day-to-day academic life talk to, and they tell you how it is. And I think it's very important for us all to take on other people's perspectives, nobody wants to be told what to do. And the frustrating thing is someone's telling you what to do if you're like, well, I can't because I just don't have the money to do that.
Okay, thank you, and thanks India for coming on for that. Just looking through some more of the questions and comments. Someone's mentioned FaceTime a farmer is a good way to get kids to think about healthy food. I haven't heard of that one myself. There's a link there if people want to follow that one up.
Yeah.
And I think there was a little bit more discussion and debate about the adolescents. Charlotte, agree with adolescents being an often forgotten group and need to engage with. I'd be curious to hear about the engagement you have had with children and adolescents in your project. E.g., it looks like children engage really well with bean meals. Any more stories like that?
Oh, thanks, Flo. Good to have you here. So I will be absolutely honest. I haven't done a huge amount of work with adolescents. Most of my work has been bean meals is with primary school children, and again, of course, not every single kid has responded in that way, but a number of kids have responded very well to the project and really engaged with it. I generally think secondary schools are just harder to work with. I might be wrong here. That's just my personal experience. Is secondary schools are bigger, kind of pupils are moving all around, so they can be a harder group to work with, and these sorts of things can be a harder sell in a secondary school canteen. I know there are lots of really good examples of young people though who are really sort of speaking out about inequalities in the food system. So we have some really great local advocates here in Liverpool. I know the the Food Foundation, I know, have a really excellent panel of young advisors who are very vocal and powerful in their sort of direct experiences of food insecurity, which is very helpful. I think the other interesting thing about adolescence, and what again, I don't really have data to back this up, but what I think is perhaps a really good angle with adolescents is the climate change angle. So again, this isn't going to appeal to every single adolescent, but I think there are data suggesting that young people in particular are concerned about climate change because they are much more invested. It's their future. In Extinction Rebellion, all that sort of thing seems to have captured young people. We're seeing veganism switching to plant-based. That is increasing in younger people. So my sort of, I don't know, my thoughts on this would be perhaps with that particular group, is the environmental climate change angle going to be more effective than the health angle? Because we've been trying for years with telling young people it's good for the health. You know, they know that going to fast food restaurants is not healthy food, but there are many other reasons why they want to go there, so health drops right down. So yeah, that would just be my suggestion, is do we need to be focusing more on climate change and environmental impact to engage that particular group?
That links to a point that Kate Bannister made a little while back. Is there any scrutiny planned into the externalities of our food system, particularly on the NHS? Should the nutritional value of food produced by manufacturers and retailers be more regulated? This was a point that Henry Dimbleby made a couple of weeks ago when we had his webinar. He got stuff from Andy Haldane, who used to be the chief economist at the Bank of England, about health related problems really affecting the economy, and food being a driver of you know, that sort of economic issue, really. So is there anything you're aware of in terms of sort of systematically looking at those externalities and things like the NHS?
Yeah, I mean, it's a really important point. I mean, I guess obviously, you know, we have all the labels, the health labels has been a really important policy change over the past few years to really sort of, so manufacturers are required to put labels with the sort of the traffic lights, for example, so that can really clearly flag some of these high fat, sugar, salt foods that we should be avoiding. So that would be one particular strategy that I could think of. And I think there's probably, I mean, again, it just isn't my area of expertise. I would hasten to add here. I think there are sort of issues around food provision itself within the NHS, as NHS sites, and looking at what sort of food is available there, what sort of food is available to hospitals. Yeah, I don't think I'm the best person to answer that question, though.
Yeah, okay.
I would defer to Henry Dimbleby.
See, there's a couple of comments from Anna McCready, who's our champion in the network on individual and institutional behaviour around food. And I mean, one point is there's lots of really good links to projects in the chat. So is there a way that we can capture those for attendees? So we'll certainly have a think about how we can do that. And there's, have you come across any issues around trust in the food system? Is it important, and has it come out in any of your empirical work?
So again, not in my empirical work. So again, I would hasten, I'm not the best person to talk about this. There will be other people with much better, a much greater expertise. But yes, I can imagine trust is a very big issue. I think if you're being encouraged to consume foods that aren't part of your sort of cultural food and eating patterns, then that can create mistrust. I mean, you know, I'm surprised no one's asked about ultra processed foods because it's such a huge topic. But you know, there's lots of distrust there and concern about so-called ultra processed food processing. There is concern that some of the foods which are promoted as being good for the planet aren't necessarily good for our health. I think there is a lot of concern around industry and around the food industry and what their motives might be. So yeah, I think it's really important and requires careful consideration.
There's a bit of beans and ready meals sort of kicking off, and some comments as well. So it's quite interesting when we think of beans, and you had a slide which showed a pot of interesting looking beans. And then there's this issue of sort of ready meals as typically highly processed foods, and that growing market for sort of plant-based alternatives, and so sort of, you know, non-meat ready meals. And I just wondered if there's any thinking on the sort of the potential for beans in ready meals that seem to be
absolutely popular. So yeah, that was sort of the thinking with the beans, is that they can, so the beans that we're serving to the children are cooked from scratch by school cooks, but there is a lot of potential for those beans to be processed. They can be made into flour, they can be used in a whole variety of issues. I mean, the whole issue of ready meals and ultra processed food is a massive topic, and I can see we're short on time, but I guess at the moment, you know, we have to accept the way we are at the moment, that convenient ready meals, you know, are a convenient way for many people to eat. And until we sort of change that system and remove sort of time pressures and costs and all that sort of thing, they are, for some people, going to be a really important part of their diet. So again, I think it goes back to this sort of harm reduction. If we can engineer and manufacture meals that contain healthier and sustainable ingredients, that's certainly something that can be done in the short term. So that, yeah, lots of potential for those beans to be used in that effect.
That's great. Well, we could go on and on. We haven't been able to get through all the questions. And the chat is still bubbling away, but we always commit to finishing at 1, mainly because we have another meeting that we go to at 1 o'clock for the network. But if I just wind up with a few comments at the end. I mean, first of all, Charlotte, thanks ever so much for your talk. It was really, really stimulating, and it's prompted lots and lots of questions. And thanks for your addressing all the questions. I just wanted to say to everyone that our next webinar is likely to be on the 9th of June, and we're hoping to do something on agroforestry for that one. So watch this space. And do look out for our podcast. So we've started generating podcasts out of the webinars. So the first one, which reflects on some of the issues that were raised in the Henry Dimbleby talk, was released just this week. And hopefully there's a link in the chat somewhere, so you can link to that. But if not, you can link to it through the AFN network website. Finally, we do welcome any comments or feedback on and suggestions for speakers for webinars or for podcasts. So please feel free to email either myself or Jez Fredenberg, who's our Knowledge Exchange Fellow and helps set up all the webinars. So thanks again to Charlotte. Thanks to everyone for coming along. I think we had 75 participants at the peak there, so it's very good. And I hope you all have a good rest of the day. Thank you very much. And bye.
Thanks, everybody. Bye.
Thanks, Charlotte.
Thanks, Neil. Thanks, Jez. Thanks, Jess.
Thanks, Charlotte.
See you again soon.
Bye.
Good weekend.
Yeah, be in touch. Thanks.
Bye.